One of my highlights at the ASCO 21 meeting, I think, was the IMpower010 trial. I mean, for me, why this wasn't a plenary, I don't know, because I think this is one of the most interesting trials we've had reported at ASCO for some time. This is a really important trial in which patients with version 7 TNM, stage 1B, more than 4 centimeters, to 3A, resected non-small cell lung cancer, who'd all completed adjuvant chemotherapy were then randomized to a year of Atezolizumab immunotherapy or not. Now, the primary endpoint is disease-free survival, and I think this is here where the controversy is. And the trialists presented by Dr. Wakely presented for the stage 2 and 3A group only, and there's a hierarchical testing of different subgroups. In the PD-L1 positive group, this is the SP263, the hazard ratio for disease-free survival was 0.66. I mean, this is very strong. But this is more than 1%, so we need to classify in the 50 to 1 to 49 and 0. In the 0, the hazard ratio was 0.79. You know, maybe not as strong. We don't know what the hazard ratio for 1 to 49 is because that hasn't been done yet. But in the more than 50%, the hazard ratio is 0.43, and that is very, very strong for a year of atezolizumab. So for many, this will be practice changing. For some, they will want to wait for overall survival, but undoubtedly, atezolizumab in the more than 50% positive patients certainly markedly and clinically meaningfully delays time to relapse. Now, whether that's an important endpoint is where the debate is. Also, this trial did enroll a small number of EGFR and ALK patients, and what was really interesting to see is that there really was very little benefit, certainly no benefit in the ALK positive patients, and very modest, if any, benefit in the EGFR mutant lung cancer patients. So, look, there we have the first of many adjuvant trials coming through, which has started to report 1 year of atezolizumab, very strong DFS benefit for the more than 50% subgroup with a hazard ratio of 0.43. And let's see how the clinical community respond to what this means.